Hello, it's Dr. Mandy, and I want to put this presentation together on iodine because I think it's often an overlooked component to improving your health and improving your bladder health specifically. And here's a standard industry disclaimer. It's important to identify and resolve any source of inflammation in your body, including gut infections, food intolerances, chronic virus infections. So the following recommendations work more effectively with people who are not currently in a state of inflammation. And the contents of this presentation are for informational purposes only and not intended to be a substitute for professional medical advice, diagnosis, or treatments. All right, so let's dive into the basics. Iodine, as many of you know, is a key component of thyroid hormones, which are required throughout life for normal growth, such as neurological development and, of course, your metabolism. It is slightly acid forming, and again, it's a thyroid mineral, and every cell of your body uses iodine. Now, the problem is insufficient iodine impairs the production of thyroid hormones, and this can lead to hypothyroidism, but of course you don't have to be diagnosed officially. There's actually a situation where you may have a subclinical hypothyroidism with iodine insufficiency. So having this can result in a lot of health disorders with varying degrees of severity, and this can range from thyroid gland enlargement even to severe physical and mental retardation, and there's actually a condition known as cretinism that involves that, but a little bit more rare. The hypothyroidism that's induced by iodine deficiency can affect all stages of development, but the most important one is it can affect the developing brain, and this is often seen during pregnancy, and it can result in not only hypothyroidism with the mother but also the fetus, but can also lead to miscarriage, preterm birth, and also neurological impairments. So the problem we run into is the RDA, and I'll talk about that a little bit, but the RDA is 150 micrograms per day for adults, 220 micrograms in pregnant women, and 290 in breastfeeding women. So during pregnancy and lactation, the fetus and infant entirely rely on you for iodine. And then there's also problems with too much iodine, with a radioactive version of it that can increase the risk of developing thyroid cancer. So for example, with radiation emergencies and things like that, there is this problem as well. Seafood is an excellent source of dietary iodine, and then we have dairy products, grains, eggs, and poultry as well. But we also have the situation where countries around the world are introducing programs of salt fortification with iodine in order to correct iodine deficiency. So as I said earlier, iodine is an essential component of the thyroid hormones, and we have T3 and T4, as you can see in this image, that are important for the normal function of your thyroid. So to meet the body's demand for thyroid hormones, the thyroid gland has to trap iodine from the blood and incorporate it into a large glycoprotein called thyroglobulin. And there's a chemical reaction, actually, it's a hydrolysis reaction, and this occurs with various enzymes to give rise to thyroid hormones that are stored and released into circulation as needed, for example, in target tissues such as the liver and the brain. Now, in these tissues, for example, T4 is the most abundant circulating thyroid hormone, and it can be converted to T3 by a selenium-containing enzyme. And we're just going to abbreviate that enzyme as DIO, as you can see down in this picture. But it's important to understand that these are selenium dependent, which is why selenium deficiency can actually result in low T3. T3 is the physiologically active thyroid hormone that can bind to thyroid receptors in your cells and regulate gene expression. So in this manner, thyroid hormones regulate a number of different processes, and that includes growth, development, metabolism, and also reproduction. And you can see how this happens here. So you have T4, it has to go through the enzymatic reaction with DIO1, DIO2 to become T3. And then you can see also, there's also reverse T3 that goes through an enzymatic reaction. But the important thing to see here is the involvement in iodine. The regulation of the thyroid function is really complex and involves the brain, specifically the hypothalamus, and also your pituitary gland. And so in response to thyrotropin releasing hormone, TRH, by the hypothalamus in the brain, the pituitary gland secretes TSH, which you may be familiar with. This is your thyroid stimulating hormone. And this stimulates iodine trapping, thyroid hormone synthesis, and the release of T4 and T3 by the thyroid gland. So the presence of adequate circulating T4 and T3 feed back the level of both the hypothalamus and the pituitary. And this will decrease TRH and TSH. So that's why when you have enough thyroid hormone, your TSH tends to be lower, and if there's not enough, you have a higher TSH. And you can see how that happens in this picture. So when circulating T4 levels decrease, the pituitary gland increases its secretion of TSH, and this results in increased iodine trapping as well as increased production and release of T3 and T4. But iodine deficiency can result in an inadequate production of T4, and that's why you can see that happening. So when the decreased levels of T4 concentrations occur, the pituitary gland increases its output of TSH. So high TSH may lead eventually to enlargement of the thyroid gland, and that's how you get a goiter. Iodine deficiency is an important health problem throughout much of the world. Most of the Earth's iodine is found in oceans, and so the iodine content in the soil varies with region by regions. The older and exposed surface, the more likely the iodine has been leached away by erosion. So mountainous regions like the Himalayas, Atlas, Andes, and Alps, also flooded river valleys such as the Ganges River plain in India, and many inland regions such as Central Asia and Africa, Central and Eastern Europe, and Midwestern region of North America are among the most severely iodine deficient areas in the world. Now this chart is showing you the US iodine concentrations in the urine, and this is showing you that there's been a decline in the overall concentrations of urine from 1971 to 2004, so over several decades. And this is becoming a pretty major concern. So another issue is environmental contamination is another main concern, and we are exposed to iodine antagonists, and that includes things like fluoride, bromide, and chlorine, and often these are found in food, air, and water, but also you can get fluoride when you go to the dentist or in your toothpaste. And these halides, they're called, compete with iodine absorption. So fluorides are one of the worst iodine antagonists, and they're often introduced through the fluorinated water supply. And bromine and bromides are also pretty bad. Those are found in a lot of baked foods, processed foods, for example, breads. And chlorine and chlorinated compounds are often found in the water. And so another issue is the intake of iodine in the diet is often ineffective if your iodine receptors are clogged with some of these halides. So what are some of the main causes of iodine deficiency? Well, one, lack of dietary iodine. For example, the Japanese people on average consumed about 6.25 to 45 milligrams of iodine daily. And the RDA is set at 150 micrograms, so you can see that the RDA is much lower than what Japanese people, for example, consume. And honestly, the RDA is really set for preventing death. So it's not really going to make a huge shift in how you are going to improve your health with the quantity of iodine that is recommended. So that's why a lot of times the RDA is actually nicknamed really dumb allowances. And it's actually, originally it's recommended daily allowances is what the acronym stands for, but sometimes it's jokingly called the other one. Often it's due to the lack of access to fresh water, food products such as fish, and sometimes people avoid sea products because of the heavy metals. There are also some foods that contain substances that interfere with iodine utilization or thyroid hormone production, and these are called Goitrogens. And the occurrence of goiter in the Democratic Republic of Congo, for example, has been related to things like the consumption of cassava. So cassava contains something called linamarin, which is metabolized to a compound that blocks thyroid uptake of iodine. Other populations, tobacco smoking has been associated with an increased risk of goiter. So there's cyanide in tobacco smoke that's converted to a compound in the liver, placing smokers with low iodine intake at risk for developing a goiter. Now, this compound, thiocyanate, affects iodine transport in also lactating mammary glands, leading to low iodine concentrations in breast milk and impaired iodine supply to neonates and infants of smoking mothers. Other foods like some species of millet, sweet potatoes, beans, and cruciferous veggies such as cabbage, broccoli, cauliflower, and Brussels sprouts also contain goitrogens. And other things like soybean isoflavones have been found to inhibit thyroid hormone synthesis. So it's important to be aware of the goitrogens. They're not really clinically important unless they're consumed in super large amounts or if there's a coexisting iodine deficiency. And finally, industrial pollutants such as perchlorate and phthalic acid can also have the same property. You may be asking, what are some of the symptoms of iodine deficiency? And they're listed right here. This is some of the many common ones. So you may have some fatigue, frustration, depression, low blood sugar, obviously hypothyroidism, cold hands and feet, slow oxidation rate, which we can actually measure on an HTMA, weight gain, a calcium shower or calcium dysregulation, which means impairments in calcium metabolism, irritability, anxiety, infertility, hair loss, and also estrogen dominance. There's some other symptoms of iodine deficiency that were indicated by Dr. Brownstein, and that includes ADD, autoimmunity, breast cancer, hypertension, infections, vaginal infections, headache, endometriosis, uterine fibroids, and liver disease. So I often will do an iodine checklist that looks like this when I am, let's say, initially assessing an HTMA, or I don't have an iodine test, because I like to use the Hakala lab, but I can't always use it depending on the state or also country. So this is a checklist, and as you can see, there's different categories that have been correlated to iodine deficiency. So if someone has symptoms and also maybe has impaired thyroid hormone production, maybe their TSH is a little higher, their T3 is a little bit low, and then this checklist is coming up with more yeses, then I can pretty much hypothesize that there's an iodine deficiency, and it can be corrected with proper treatment. So here's a snapshot of the Hakala lab. It's a urine test. It's 24 hours. And as you can see in this particular example, there is absolutely iodine insufficiency because the excretion is less than 90%. And then you can see the halides here. So in this case, there's quite a bit of fluoride or fluorine in the urine, which could be affecting iodine absorption. So that would have to be investigated to see if it's coming from the water or from some dental procedure. And then there's chloride as well. So it's always important to be able to take a look to make sure you can identify where the source could be coming from, because it's not always dietary intake, although it could be. Another assessment to do, obviously, is a full blood panel of the thyroid, and that includes RT3, free T3, total T3, and also the antibodies, right? But if you take the total T3 and divide it by reverse T3, and if you have a value less than 10 and an overall low T3, it could be an iodine issue, but often it could be liver conversion issues as well as selenium, iron deficiency, and estrogen dominance. Now you could take the free T4 and divide it by the free T3, and if that's greater than 4, then it's a conversion issue. So you have to support it with these things up here. And if the total T3 and the RT3 ratio is greater than 14, that's pretty much an absolute iodine deficiency. So once an iodine deficiency has been identified, the first thing that I always tell everyone to do is to start with the cofactors for 6 weeks. And luckily, Vicon is an easy way to get your cofactors. So the cofactors are about 400 to 500 milligrams of magnesium, 1,500 milligrams of vitamin C, but I have to caution people with oxalate issues, especially with IC. So I lowered the dose in most IC formulas with the Camu. Just because it's a little risky to take that much vitamin C when you're dealing with oxalate issues. 200 micrograms selenium, 100 milligrams riboflavin 5-phosphate, 500 milligrams niacinamide, and obviously increase sea salt daily to flush halides off iodine receptors. That could be tricky for people who have high blood pressure that are salt sensitive, so you have to first identify if you really are salt sensitive before you start increasing your salt. Obviously, we don't want you having high blood pressure, so there's a little caveat there. Now, another thing is Originally, they were recommending 2 to 4 grams of vitamin C, and we know this can be a problem with copper dysregulation, and high dose vitamin C can actually lead to copper dumping. Sometimes it makes me wonder if the oxalate issues are copper related, but I haven't been able to identify that yet. So the sweet spot is 1,500 milligrams, but again, if you have IC or oxalate issues, then you want to stay at the lower dose. Sea salt is really good. It flushes halides from iodine receptors, and it'll provide the sodium for the transporters to put iodine into the thyroid cell. So these are the sodium iodine co-transporters. So the most important cofactors for this is sea salt and selenium. After 6 weeks, you can start 1 drop, and I'll go over that in a minute. But if salt is especially low, sodium is low on the hair, definitely want to do salt loading, definitely. So again, the caveat for this is if you have high blood pressure or you have salt sensitivity that are causing high blood pressure, then you may not want to do this to this capacity. But everyone else, upon arising, you want to do 1/4 to half a cup of salicylic sea salt in half a cup of hot filtered water. It should be really hot water, almost to the point where you can just barely tolerate it, how hot it is. After you do that, you're going to chase it down with 12 to 16 ounces of cool filtered water and do it all at once. And then you're going to repeat every 30 minutes until you have to go to the bathroom. Usually they say to repeat it 3 or 4 more times. So this is really also helpful for people who are having a Herx reaction or a die-off reaction from iodine, because iodine is detoxifying. It is a very detoxifying agent, and you may have a bad reaction, and if you do, it's usually due to a die-off reaction or a Herxing movement of the toxins. Okay, so I would do take a 1 ounce glass, which comes out to be a shot glass, and fill half of it with water. That makes it half an ounce, and put a drop of Lugol's in there. And this is going to be a dilution. So you're going to order the 2% Lugol's, like I said. You can see the picture here. Mix 1 drop in half an ounce of water, which is half of a shot glass, and then grab a clean dropper and pull 1 drop out of this dilution. So diluted solution, and mix it in another amount of water. So mix it in water and consume it in the morning. Now, just for your own reference, 2% of Lugol is 2.5 milligrams of iodine. So this one here is 2.5 milligrams per drop, and 5% Lugol's is 6.25 milligrams per drop. Now, over the next 10 to 14 days, so about 2 weeks, you're going to slowly decrease the amount of water you're putting the drop in until you're taking 1 full drop. So as I just said, slowly decrease the amount of water in the dilution from half an ounce of water to nothing over the next 10 to 14 days. And if you tolerate it well, next week, just use a drop of iodine in water, but never consume it undiluted, meaning don't mix it and don't drink it the drop by itself. Just make sure you always have it in water. Now, again, Lugol's 2% is 2.5 milligrams per drop, and you're going to use 1 drop for 2 weeks before adding a second drop. If you feel okay, you can go ahead and increase it to 2 drops in a little water in the morning. If you start having Herxing or any kind of, die off, then go back to the dose where you were before that you didn't have that. Or you can pulse dose, which I'll talk in a minute about. With pulse dosing, you're going to take 48 hours off and salt flush each morning. So as you know, iodine displaces halides, and this can cause a reaction in some people. Sea salt will help flush the halides from your system. And make sure that you are using an appropriate binder, because this is critical for toxin removal. And this is why I like the zeolites and different things like bentonite clay and charcoal, all those things. So a combination of the zeocharge or any good quality zeolite with perhaps GI detox could be very beneficial. Now also, if you have the C677T, especially if you have a heterozygous polymorphism of that, you are not one that detoxes well, so you have to be even more careful. Common initial reactions include diarrhea, insomnia, feeling jittery, nausea, and if that happens with a nausea, you can try Iodine, which is the pill form, and a racing heart. If that happens, it's actually really normal, and you can either just push through it or you can make the changes. I would recommend the pulse dosing and increasing your binders. So again, for iodine to operate and get into the transporter system, I said the body uses the TSH. And so a lot of times people will see a rise in their TSH, and sometimes very high. And if that happens, don't let the doctor scare you. Oh, you're hypothyroid. If you're taking iodine, this is a normal reaction. Please just understand it will pass. And it also often gets elevated if people were starting off very deficient in iodine. Again, it's important to track your blood work. I know it's extra cost to do so, but it's important while you're doing this to continue to track. One thing to be aware of is Hashimoto's and Graves' disease. These are autoimmune disorders that affect the thyroid gland, and iodine can still be used in both cases, although some people say it's contradicted, but no, it actually can be used, and you can read my blog about that. But it's important to know if your antibodies are elevated, because that's going to change how, vigorously you go. TPO antibodies are part of the oxidase phase in the thyroid cell, so iodine needs to be started at a much lower dose. And iodine is oxidizing and may aggravate this. So keep the protocol, but keep the dilution of 1 drop in ½ ounce of water and use that for a month, and also the cofactors. The antibodies really do tell you an overall picture of the liver. So elevated TPO, often you need to look at phase 1 liver support, and then thyroid globulin antibody gives us phase 2 liver. And if you have both, well, obviously you have to address phase 1 and phase 2. And finally, you need to be aware of various nutrient interactions. One of them is selenium. I said that selenium is important in the conversion of T4 to T3, and T3 is your active thyroid hormone. And the enzyme activity is involved in regulating iodine homeostasis. Now, also keep in mind, glutathione peroxidases are also dependent on selenium, and the glutathione is what protects the thyroid gland from hydrogen peroxide damage during the time where your thyroid is making thyroid hormones. So people who have selenium deficiency have a higher risk of autoimmune thyroid disease as well. So they find that about 200 micrograms per day of selenium seem to have reduced the thyroid dysfunction. The next one is iron. Severe iron deficiency anemia can impair thyroid metabolism, 1, by altering the TSH response of the pituitary gland, but 2, by reducing the activity of thyroid peroxidase that catalyzes the iodination of the thyroid globulin for the production of thyroid hormones. And the third way that this affects the thyroid is in the liver, it limits the conversion of T4 to T3. Then this increases T3 turnover and decreases T3 binding to different receptors. So interestingly, that goiter and iron deficiency anemia can coexist in up to 25% of school-aged children in parts of the world. So iron is another one to be aware of. And then the last one is vitamin A. And they found in North and West Africa a vitamin A deficiency and iodine deficiency induced goiter, and they can coexist in up to 50% of children. So your vitamin A status, like other nutritional factors, appear to influence the response to iodine prophylaxis. Vitamin A deficiency was found to interfere with the pituitary thyroid axis and increases the synthesis and secretion of thyroid stimulating hormone by the pituitary gland, and can increase the size of the thyroid gland and reduce iodine uptake, and impair the synthesis and iodination of thyroid globulin and increase circulating concentrations of thyroid hormone. So one thing you have to be aware of, I see a lot of polymorphisms in vitamin A conversion from beta carotene. And so you have one of those polymorphisms, it's probably important to have some vitamin A on board, and a lot of the slow oxidizers are already using vitamin A in Vicon. So for many of you, that's already been covered. They found that vitamin A supplementation can decrease TSH concentration compared to control. So in summary, if iodine deficiency is found or suspected, work with me after 6 weeks on making sure you get your cofactors. Make sure you have conducted the blood work for the thyroid. Go very slowly with iodine. Retest the HTMA in 4 to 6 months, and retest Hakala, if applicable, in 4 to 6 months to make sure that your body is responding properly to the iodine therapy. And that's it. Thank you.